Let us look at epidemiological surveillance. It can be divided into active surveillance, which involves actively seeking out of cases through systematic data collection efforts such as targeted screening, surveys, or field investigation. This approach is useful for detecting diseases with low baseline incidence or for monitoring specific populations at higher risk. Passive surveillance relies on the voluntary reporting of cases by health workers, laboratories, and other sources. It's often used for diseases with well established reporting mechanisms such as notifiable diseases. Syndromic surveillance. In syndromic surveillance, patterns of symptoms or clinical presentations are monitored. It is usually used to detect outbreaks or unusual health events in real time based on early warning indicators such as through emergency departments or absenteeism rates. Sentinel surveillance. This involves monitoring a subset of health facilities or specific geography areas to provide representative data on disease occurrence. It's often used to track trends in disease with substantial regional variability or to monitor the effectiveness of interventions in selected populations. Let us now look at outbreak investigation. Outbreak investigation is a very critical component of public health practice aimed at identifying and controlling the spread of infectious diseases within populations. Whether it's a localized cluster of cases or a widespread epidemic, outbreak investigation involves the systematic and methodical approach to understand the cause, transmission dynamics, and risk factors associated with outbreak. It has multiple steps. The first is detection and recognition of what is causing the outbreak and what is the disease. The next step is confirming the outbreak, confirming the disease, and defining the case in point. The third is to understand the descriptive nature of epidemiology involving the agent, host, and disease. Next step comes is the hypothesis generation, trying to understand and curate what is leading to the outbreak and what can be done about it. Then we go to analytical epidemiology, wherein we start analyzing what is causing the outbreak, adding various permutations and combinations in known understanding. Then we look at the environmental assessment, whether there are any external environmental factors which have contributed to the outbreak. For example, it is claimed that COVID 19 started spreading through the meat markets of China. This tells us how an external environment other than a human body contributed to spread the infection into the host. The next step is to plan for control measures and response, after which official communication and reporting needs to be done with evaluation and lessons learned in the outbreak of a disease. Epidemiological surveillance is the cornerstone of public health practice, involving continuous monitoring and analysis of disease occurrence trends within population. It aims to analyze, interpret health data, look at epidemiological surveillance from a disease prevention, outbreak detection, and a final public health decision making background. It aims to monitor the occurrence of disease and health related events, detect outbreaks, identify trends and patterns in disease occurrence, evaluate the impact of public health intervention and control measures, and provide data for planning and resource allocation in public health programs. Components of surveillance include data collection, wherein Data is collected through various sources, could be healthcare facilities, labs, and public health agencies. Data analysis and interpretation is done to identify trends, detect aberrations in occurrences, and assess the burden of disease within population. Lastly, it boils down to reporting and communication. Timely reporting of surveillance findings is essential to inform public health risk informed action. Surveillance data are communicated to relevant stakeholders, including healthcare providers, policymakers, and the public through regular reports, alerts, and dissemination channels. Quality assurance in surveillance systems incorporate mechanisms to ensure the quality and accuracy of data collected. This may include validation checks, data audits, and ongoing training for personnel involved in data collection analysis. In epidemiology, distinguishing between causation and association is important. While association refers to the statistical relationship between an exposure and an outcome, causation implies a direct cause and effect relationship where the exposure directly influences the occurrence of the outcome. Epidemiology studies, such as cohort studies or case control studies, are designed to assess whether there is an association between an exposure and an outcome. For example, consider a study investigating the association between smoking and lung cancer. Researchers might find that individuals who smoke are more likely to develop lung cancer compared to non smokers. This observed association suggests that smoking and lung cancer are related, but this does not prove causation. Causation implies a direct cause and effect relationship between an exposure and an outcome, where the exposure directly influences the occurrence of the outcome. For example, in the case of smoking and lung cancer, if researchers conduct a randomized controlled trial where they assign individuals to either smoke or not smoke over a long period and find that smokers have a significant higher risk to develop lung cancers, this provides strong evidence of causation. Epidemiology employs a range of research methods to investigate the distribution and determinant of health related events within a population. These methods help gather data, analyze patterns, and draw conclusions to inform public health intervention. Descriptive epidemiology involves the systematic analysis of data to characterize the distribution of health related events such as diseases or injuries within population. This includes examining patterns of disease occurrence by time, place, person to identify trends and disparities. Analytical epidemiology focuses on identifying and evaluating the determinants of health related events. This includes investigating association between exposure and outcomes using observational and experimental study design. Observational studies, including cohort studies, case control studies, and cross sectional studies, are used to assess association between exposure and outcomes in population. Experimental studies, such as randomized controlled trials, are used to evaluate the effectiveness of an intervention or a treatment in preventing or controlling diseases. Surveillance involves the ongoing systemic collection, analysis, and interpretation of health data to monitor disease trends. Meta analysis is a statistical method used to combine data from multiple studies on a particular topic to provide a more comprehensive estimate in the association between exposure and outcomes. Meta analysis can help synthesize evidence, quantify effect sizes, and identify sources of heterogeneity across the study. Epidemiologic modeling involves the development and use of mathematical models to stimulate disease transmission dynamics, assess the impact of interventions, and inform public health policy decisions. The prime purpose of epidemiology is the application of finding in health promotion, in healthcare policy, and in health system strengthening to improve the health of populations. The epidemiologic triad is a model that researchers have developed for studying health problems. The triangle consists of the agent, host, and environment, like how you can see in this picture. One critical component in looking at epidemiology is to understand the iceberg phenomenon of the disease. A lot of times, what we can see in front of us, the cases we can deal with, is what we think is the disease at hand. But actually, what we don't see is the fact beneath the water, how big is the iceberg. That is where we need to go to the bottom of epidemiology to understand how deep the disease is rooted and what can be done from a public health standpoint to prevent and to further the progress of humankind.